Okay, this is tape 1 to the video deposition of Dr. Elias G. Chalhub, MD, in the matter of Elliot Jackson and Nicole Jackson, plaintiffs versus University of Mississippi Medical Center, Paul Trotter, DMD, Nancy Dellinger, DDS, and John Doe's 1 through 10 defendants. In the Circuit Court of Hinds County, Mississippi, 1st Judicial District, cause number 251-12-366 CIV, taken in Mobile, Alabama on January 9th, 2014 at 4:30 p.m. Will those present please identify themselves, and the witness may be sworn.
Whit Johnson on behalf of the defendants.
John Clark for the Mr. and Mrs. Jackson.
Doctor, would you please raise your right hand? Do you solemnly swear or affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
We are making as Exhibit 1 the notice of trial deposition. Doctor, would you state your full name?
Elias Chalhub.
Right. Dr. Chalhub, what do you do for a living?
I'm a physician specializing in neurology.
All right. And where do you live?
Mobile, Alabama.
And where do you practice?
Mobile, Alabama.
Okay. I'm going to hand you what I believe would be a copy of your CV and ask you to identify it.
This is a copy of my CV.
Okay. And this sets forth your training and experience and various other things that you have done throughout your practice.
Yes.
Okay. We'd ask this to be marked as Exhibit 2.
No objection.
Doctor, I'm here today to ask you some questions about a gentleman by the name of Elliot Jackson who suffered a head injury from a fall with a subdural hematoma. Would you tell the court what in your training experience gives you the ability to speak to issues that arise in connection with such an injury?
Well, first of all, he had a syncopal episode.
But let me back up. What I'm asking is, in your training experience, what gives you the ability to talk about those type of issues, like medical school training?
I'm sorry. Okay. Yes. Well, I went to medical school at Emory University. Then went to an internship at the University of North Carolina at Chapel Hill. Then I did a fellowship at the National Institute of Health in Bethesda, Maryland, which was then followed by a residency at Washington University in St. Louis. This was then followed by an adult neurology fellowship at Washington University, which was then followed by a child neurology fellowship, and then I went into academic medicine at the University of Arkansas. Then came to Mobile and taught adult and child neurology, and have been in practice since the early 1980s, seeing both adult and child patients.
Does your practice include the diagnosis, care, treatment of patients who have suffered head injuries?
Yes.
Does it include the diagnosis, care, and treatment of patients who have suffered a subdural hematoma?
It does.
All right. Just real briefly explain what a subdural hematoma is.
Sure. A subdural hematoma is blood that collects underneath the coverings of the brain called the dura, or the dura mater, which is right underneath the bone. And it's usually due to some tearing of some veins which go through the dura mater to the brain. And they can be acute, they can be subacute, they can be chronic. And generally, if there is no neurological deficit and the patient does well with a normal level of consciousness and it's not large, we watch them and they generally resolve.
Okay. At this point in time, I would offer Dr. Chalhub as an expert in the field of neurology.
I don't have any questions at this time.
Okay. Doctor, at my request, did you review various records of Mr. Elliot Jackson, specifically with regard to the injury he sustained when he fell at the UMC Dental School and the care that was provided to him both there at UMC and then later at Memorial Hospital of Gulfport by Dr. Bolters?
I did.
Okay. Tell us generally what you saw in those records.
Well, Mr. Elliot had been undergoing a series of dental procedures, and the one in question, I think in December of 2010, he was going to have some extractions, received some local anesthesia, got up from his chair, went to the waiting area and had a syncopal spell. And by syncopal spell I mean He had a fainting spell. Generally, it's either due to stress, anxiety, your blood pressure going down. Sometimes if you have a systemic illness, it can be related to that. But he's 27 and really didn't have any other heart problems or problems that would lend you to having a syncopal episode. As a result of that, he had a subdural in the right frontal area, and was then subsequently admitted to the hospital, where I think the neurosurgeon saw him, felt it was a mild head injury with a subdural. He was observed for 5 days and then went home.
Okay. Subsequent to that, he came to the came back home and was seen at Memorial Hospital, I believe, where they did another CT scan. Do you recall that?
Yes, that is
correct.
correct.
Did the CT scan show anything any different, or did it show a stable situation?
Pretty stable. I think he had a contusion in the right frontal lobe in addition to the subdural, but that is not unexplained. I mean, not unexpected with that type of fall.
All right. I also believe, was there some subarachnoid blood that they saw?
Well, that's, you know, when you get into the subdural space, it's hard to tell the difference between the subarachnoid space and the subdural space, you know, except if it goes all over the brain, and in this particular case, it didn't go all over the brain.
All right. So we're dealing here with a limited situation.
I think so, in the right frontal area.
Okay. All right. In your history and experience, given the findings that were on the scan or the scan reports, to a reasonable degree of medical probability, would you have expected any long-term neurologic sequelae or any problems for Mr. Jackson?
Let me object to the form.
Okay. Well, based on, if he just had a subdural hematoma and you knew nothing else, then there certainly could have some long-term sequelae. But the fact that he had a normal Glasgow Coma scale, he had no focal neurological deficit, he had no seizures, he was essentially well in 5 days in terms of any neurological problems, then you would not expect someone to have any significant neurological residual deficit from a frontal lobe lesion.
Okay. All right. With regard to how long, to a reasonable degree of medical probability, would you have expected it to take for Mr. Jackson to return to his baseline, to his prior state of health, given the findings on the records from the head injury?
Well,
Object to the form again. Go ahead.
Can I ask you to explain what your objection is so I can try to cure it?
Well, you're asking generally, you know, and that's overbroad.
Okay,
And
I'll rephrase.
and it's not specific to
Okay.
Elliot Jackson.
All right.
And I don't mind you asking, you know,
Okay.
because you don't have a chance to cure later.
All right. Doctor, first off, can we agree that all the questions that I ask, that you will answer them to a reasonable degree of medical probability?
okay.
Okay. All right. Then specifically with regard to I want you to assume the findings as reflected on Mr. Jackson's scans, the findings and the care that was provided to him at the UMC prior to going to Memorial, going home, and then also the findings at Memorial when he was seen there in the emergency room in early December. Assuming those to a reasonable degree of medical probability, when would you have expected Mr. Jackson to return to his baseline state of health?
Okay, again, assuming that there was no additional injuries, assuming that he had no neurological deficit, which wasn't described, and assuming that he had no additional neurological signs and symptoms, it could be as short as a period of 3 weeks, it could be up to 3 months.
Okay. All right, if we add in that assumption that Mr. Jackson was back at work in approximately 3 months, how would that fit with what you would, to a reasonable degree of medical probability, expect to see in a patient such as him with the injuries he had?
Well, I would think that certainly would be consistent with not only the injury, but then his clinical course. You have to understand that subdurals can take different pathways, but when it's a limited subdural that's observed in a patient, and I think actually the next day he wanted to go home when he was in the hospital, then you would expect them to make a reasonably full recovery and get back to their baseline and get on with their life. We see subdurals very commonly in a number of people that are totally asymptomatic.
All right. Now, Mr. Jackson has made various complaints. It's right there. I want you to assume that Mr. Jackson testified, and did you read his deposition?
I did.
Okay. I want you to assume that he testified that after the fall, he did not have any memory until waking up 3 to 4 days later. Making that assumption, that he had no memory from the time of the fall until 3 to 4 days later, to a reasonable degree of medical probability, what would you expect him to be able to remember of the events leading up to the fall?
Let me object to the form of the question and also object on the basis outside the scope of the designation that would have been provided to us by the defendant.
You can go ahead and answer.
Well, if he stated, as he did in his deposition, that he had no memory for that period of time, I would expect him to have no memory at the time of his deposition for the events. There's no reason to believe that he's going to get his memory back.
Okay. All right. With regard to the do you believe from your review of the records of the care provided by Dr. Walters and by the other physicians to Mr. Jackson, do you believe that Mr. Jackson, to a reasonable degree of medical probability, has any long-term neurocognitive deficit as a result of the fall?
No, I don't see anything new. I mean, his previous records show that he has a whole host of emotional problems. He has drug abuse, alcohol abuse. He's had previous head injuries. He has had what was termed a post-traumatic stress disorder. And in fact, the allegation that he lost taste and smell, he said he has had for 7 years, which he lost in 2003 and 2004. So I see nothing new in his clinical, picture at the present time that he didn't have since at least 2003.
Okay, I'm going to ask you, did you review the Veterans Administration records?
I did.
Okay. And I'm going to ask you to look at a note from the neurology clinic dated January 24, 2012, up at the top of the page. What does that reflect with regard to headaches and also loss of taste and smell?
Says headaches might be his lot in life. He had the worst headache, really worse, after he ran and hit a truck and had a loss of consciousness for 1 to 2 minutes. He also had loss of smell and taste right away. Came home in 2004, sought help. He also had alcohol and I suspect problems, which I think he's had.
Okay. Did his records at the VA hospital reflect any issues with hearing problems, like ringing in the ears, tinnitus?
Yes, he did have that.
How can you tell us whether or not that would be consistent with the head injuries he suffered while overseas?
Yeah, that certainly could be.
Okay. And did you... You had mentioned prior use of prior drug history. First off, was there any reference in Dr. Walter's notes to any drug history?
No, I thought that was somewhat unusual. It appears that Dr. Volkers asked him and he denied that he had any drug abuse.
All right, I'm going to show you a record that, again, is from the VA records that is, the date of the note is October 18, 2011, and it's multiple pages, but I'm going to show you the third page up at the top and ask you to read that.
Yeah, veterans report using ecstasy, mushrooms, cannabis, which is marijuana, and alcohol as a way of distancing himself from his disturbing emotions.
Okay. All right, and then we'll ask you to look at this. Another day the note is October 18, 2011 from the VA records, and this is a TBI consult. And there's where he talks about the when is it dated that the loss of smell occurred?
it states that he had loss of smell that never cleared from 12/2003.
Well, look up at the top. Is there not a September 2003 date? And
Yes.
kind of read that September 2003 entry.
Initial TBI clinic visit, Iraq times 14 months, 2003-2004, Army Guard, 9/03, driving a 2-ton truck when IED exploded, throwing a Calvar screen into his head, throwing the patient against and inside the vehicle. He had questionable loss of consciousness. He states that was told possibly had loss of consciousness, but did not feel as though he had loss of consciousness, was stunned and confused. 1 minute, completed mission, evaluation done a few hours later, given anti-anxiety medicine, loss of smell that never cleared.
All right, and then we'll hand you a note. It's dated September 30, 2011. Is the date, and if you would just start where if you would read this and start where it says it appears his combat eligibility is expired. In that it's on that second page.
Okay.
Yeah, yeah.
All right.
The first page
Oh,
I
I'm sorry,
just
here
gave
it
it
is,
to
I
you.
got it. It appears that his combat eligibility has expired. He has not applied for service-connected disability. Indicates that I have tried to work on the problem for 7 years, but didn't do a very good job. I have severe headaches most of the time, ringing in the ears. Has outbursts with other people. Can't related with non-veterans. I can't smell or taste anything since I was banged up in the ambush.
That's good. Having reviewed those records from the VA, did anything in those records indicate to you that he was attributing his injuries to the fall at UMC?
I think he was attributing his loss of taste and smell, his headaches. I think he even said some memory problems, which I think the records really clearly reflect he had long before that, to that head injury. But I don't see anything any different than he's had since 2003.
No. Did you see in these records where he was relating that to his service in Vietnam, in service in Afghanistan? Is that
no,
what
in 2011 he made no reference to anything except the service in Vietnam,
Okay.
or Iraq, excuse me.
All right. Doctor, to a reasonable degree of medical probability, would Mr. Jackson, by the time he returned to work 3 months later, had been essentially back to baseline from whatever injury he suffered at UMC?
Let me object to the form of the question, and I specifically object on the baseline. What do you mean by baseline?
Right, well,
Do you mean MMI, or do you mean back to normal?
No,
That's
that's fine. I'll rephrase it.
yes, I'm just giving you that opportunity.
Doctor, when we say baseline, what do we refer to?
Well, his previous pre-morbid, we're talking about this incident, function and problems.
Okay.
And he had a lot of problems prior to this head injury.
Okay.
And I don't see anything different in what he's complaining of now than he has had for many years.
Right, and that was my question. To a reasonable degree of medical probability, when Mr. Jackson was back at work, approximately 3 months after his fall at UMC, to a reasonable degree of medical probability, would you have expected him to be back at the level he was at prior to the head injury?
Yes.
That's all I have.
Okay. When were you retained, Dr. Chalhub?
3 or 4 months ago, as best I can determine.
Well, I need an exact date. Do you have it in your records?
No, I don't.
Well,
Mr. Johnson hopefully could give it to you, but I don't know.
you don't keep a track of when somebody retains you?
You know, I really don't.
Well, who does keep track of that? Somebody here in the office?
No, I mean, usually get the records and then I communicate with their office. But in terms of telling you exactly what date, I don't have a record of that.
Okay, none whatsoever?
No.
Okay. Do you know when did you issue him a written report?
No, he didn't ask for one.
Okay. And they normally don't do that when they hire you as an expert, do they?
Some people do.
Yeah. All right, so how did you give him a report?
I talked with him.
Okay, and so,
Talked with his associate,
okay, and who's his associate?
Lorraine Boykin.
Okay, all right, so you talked to them and based upon your verbal response to their questions, that's how they came up with your designation.
You know, you'd have to ask Mr.
Okay.
Johnson that, but
Okay, so when they hired you, did they pay you?
they did.
All right, and when did they pay you?
After I reviewed the records.
Okay, and do you have a record of when you got paid?
I have I have a bill, but I don't have it with me. I can certainly provide it to Mr. Johnson, or he can give you a copy of it. I don't
Well, I'd like to
problem
have a
with
copy of it. How-
Well, he can give that to you.
Okay, somebody in your office can't give us to it, I'll be looking for it right now, so we can
No.
attach it to the deposition?
No.
There's nobody here who handles your billing that can provide us a bill?
No, I send the bills myself.
Okay. So who keeps a file on your bills?
I do.
Okay, and is that here in the office?
No,
Okay. So do you keep it at home, or do you?
I do.
Okay. Do you keep that for all billing, or only your billing pertaining to your expert opinion testimony that you give in cases?
Mostly for the expert opinion cases.
Okay. So you say you gave this, you were retained 3 or 4 months ago. At the time that you retained, what specific documents did he give you to begin with?
I can tell you that.
Okay.
He gave me the dental records, the records concerning the event, the veterans hospital records, the records of Dr. Volters. I think there were some follow-up records, and then a whole host of depositions, which I can tell you if you would like, which I got subsequently.
Yes.
Okay.
All right. Let me ask you this. Did you get any of the depositions prior to getting the records?
No.
They all came in after you'd already had the records?
Well, I had the deposition of Mr. Jackson and his wife, I think. And then the other depositions came after that.
Okay, so you had those at the time that you received the records, the depositions of Mr. Jackson and his wife?
That's correct.
Okay.
You want the rest of them? Or you
Yes,
want-
which are the other ones that you looked at?
Let's see that stuff. Ray Holder,
Okay,
Mark Livingston, Darlene Bryant, Tracy Dellinger, Katash, K-A-T-A-S-H McGowan,
D. Graham, see in there?
yeah, D.D. Graham's here, and Dr. Volters, and then Dr. Trotter, I think.
Okay.
I think
Now-
that's it.
Now, you received all those records after you had already verbalized your opinions to him about Mr. Jackson's.
Well, I mean, my general opinions. I mean, obviously, I can't tell you everything that in that conversation because I can't remember it.
Okay, I understand. But the additional depositions you got, you did not have the time that you talked to him and gave him your original opinions.
Well, we talked subsequently. I mean, I talked with Mrs. Boykin, not with Mr. Johnson, subsequently after I got those depositions. So we had some additional conversations.
I understand, but your designation was done on September 10th, 2013. When did you receive all the rest of those depositions?
Sometime after that.
Okay. And your designation hasn't been amended in any way or shape or manner, has it, that you know of?
I mean, that's not something I do, so
Okay.
I don't know about that.
Thank you. You're not an expert in psychiatry, right?
No, that's correct.
You're not an expert in radiology.
No, we do read our own films.
I do, but you also have that, you know, read secondly by a radiologist, do you not?
Well, they're read primarily because that's what the hospital rules are, but we always look at our own films.
Sure. Now, your report or your designation, did you review it? Have you reviewed your designation?
Mr. Johnson read it to me. I've not reviewed it.
Okay, all right. In your designation, there is nothing in there that you say negative or bad, or that you disagree with any treatment or care received by Mr. Jackson, by Doctors Walker, Gray, Chambers, Stacy, or Volters, after you got hurt.
I don't disagree with any.
Any of that?
Nope.
And you don't disagree that any of it wasn't reasonable and necessary?
No, I mean, they're seeing a gentleman that has multiple complaints that had a previous head injury, so I mean, I have no problem with that.
Okay. You state that the neurological and neurocognitive issues that Mr. Jackson have are more reasonably attributable to combat episodes during Mr. Jackson's military service. What neurological or neurocognitive issues that he complained about are you talking about?
Well, he had what was described, at least in the veterans' records, post-traumatic stress disorder. He had anxiety. He's had memory problems. I think even since school. I think he had a 10th grade education, and obviously he had to have some problems in his overall abilities if he just went to the 10th grade. I think he got a GED and then went on. And now apparently he's doing the same job as he's done before, and he's apparently doing quite well.
And those are problems that are also within the records at the University Medical Center and Memorial Hospital at Gulfport and Dr. Volters.
What information?
These neurocognitive problems and neurological problems.
No, I don't think he told Dr. Volters everything, at least by the records. I mean, he denies drug abuse, denies alcohol. He didn't tell me about the previous headache problems. I don't see any records in Dr. Volters about all of his head injuries, his post-traumatic stress disorder, his taking of Lexapro, Prozac, etc., all of the anti-anxiety agents he's taken for years.
What about anxiety and depression? Did you see all that?
Yeah, that's been going on since 2003.
Okay, we're going to talk about that in a minute.
Sure.
Prior to 2010, December 1st, 2010, do you have any medical records pertaining to any treatment that Mr. Jackson received for any of these neurological or neurocognitive problems that you're talking about?
Well, the veterans' records reflect
Now, let me ask you, are there any records from prior to December 1st, 2010? Listen to my question.
Okay.
These records are from 2011.
Oh, no, I don't have any records of him prior to that, excuse me.
So there's no records that you know of that he has ever received any treatment from any medical person that date prior to December 1st, 2010 for any neurological deficit or issue or neurocognitive problem.
Well, I mean, they're reflected in the veterans record. Are you saying they're lying? I mean, are they not reflecting the truth?
You're not answering my question.
Well, I'm trying to. I mean, I'm having a hard time understanding. No, the records don't exist, but he clearly relates all of his treatment, all of his problems, his medications, his drug abuse, his alcohol abuse to the veterans people. Now, I assume he's telling the truth.
Yeah, but that's records from October of 2011, is it not?
It doesn't matter. They're getting his past medical history, which is what you do as a physician when you ask a patient about what they've had and the problems that they've had. Now, if he's not forthright and honest, then what are we to accept in any of these records?
Answer my question again. Those records relate to treatment he got from the VA in October 2011.
they relate. But in those records, when in part of, wait a minute, let me finish now.
I don't mind letting you finish, but you're going beyond my scope of my question.
Do I get to answer the question
Yeah.
the way I want to answer it? Or
You can answer, yeah, you can.
Okay.
I don't have a problem with that,
All right.
but
But
you
the-
must first answer the question that I
I
asked.
said that. There are no records that I have. Now, they obviously exist because he did receive treatment, but I don't have those. Now, what he is related to the veterans is a lot of treatment since 2003, 2004 with a lot of problems. Now, I assume that is true. I don't know why they would put that in if it's not true.
Well, I'm going to move to strike any of your testimony that records existed, evidently exist that don't have. That's just pure speculation.
No, it's not speculation, Mr. Clark. It's in the VA hospital records. That's part of his medical record. That's what you do as a physician in obtaining past medical history. Now, if somebody's lying, then you know, they're obviously not correct. Now, if you tell me he's lying and not telling the truth and told the veterans all of these stories, then, you know, we'll have to look at that.
Okay, but to get back to my original point, you don't have any medical evidence or records that have been provided to you that exist prior to December 1st, 2010.
I do not have the records. I have the notes that Mr. Jackson related to the people that were treating him at the Veterans Hospital concerning his past medical history.
Okay, I understand that.
Okay.
But none before December 1st, 2010.
I don't have the actual records.
Thank
okay?
you. Do you have any evidence other than the VA records of 2011 that Mr. Jackson received any treatment for PTSD or headaches prior to December 1st, 2010?
No, I mean, the record reflects numerous, references to that, going all the way back to 2003. But do I have any other records to support that, other
Yes.
than what Mr. Jackson, in good faith, told the VA hospital? No.
How do you know he told them that in good faith? Were you present?
No, but why wouldn't you do that? You're going to
Okay.
tell somebody that's trying to help you the wrong thing? I mean, that doesn't make any sense.
Did you read his deposition?
I did.
Did you read his explanation about what happened at the VA and why he quit going to the VA?
Well, it's a long deposition. We could turn to it.
No. Do you recall anything
No,
of him?
I don't recall.
I didn't think so. You didn't do a person-to-person evaluation of Mr. Jackson, did you?
I did not.
Never met him before, have you?
I have not.
You wouldn't know him if he walked in his room, would you?
That's correct.
You wouldn't know his wife if she walked in his room.
Nope.
You didn't ask the counsel for the University Medical Center to give you an opportunity to do an in-person defendant medical evaluation of Mr. Jackson?
I did not.
And you weren't asked by them to do that?
No, that's correct.
Do you understand that under our rules that you could have had a person-to-person evaluation of him, do you?
I do. I mean, I read Dr. Volter's. He has no neurological deficit. The only complaints are subjective, which he had prior to the episode.
Wouldn't you be in a better position to evaluate Mr. Jackson if you had done an in-person evaluation of him?
Well, his neurological evaluation is normal. It's been normal by everybody that's seen him, even from the time of the accident. Now, in terms of what he has to say, obviously he tells some people something and some people other things. So I mean, I could certainly, I would have been able to ask him that, and I don't know what he would have told me.
I mean, you don't dispute for 1 minute, at least it's not in your report, that he suffered an acute head injury, a subdural hematoma, do you?
Oh, no, absolutely.
Okay.
He had a syncopal spell, hit his head, had a subdural hematoma.
No doubt?
No doubt about it.
Speaking of combat, do you know what Mr. Jackson's position was while he was doing his tour in Iraq?
What his what?
What his position was?
No, I don't know what his rank was or position.
You don't recall how many alleged purported episodes where he may have come under fire, how many he had?
I don't know the number.
You didn't notice that in the VA records, did you?
No, I mean, they've made reference a number of times to them, to his injuries.
You don't know if it's 1 or 2 or 3 or 100, do you?
I don't.
Did you receive in all the records the actual MRI reports,
I did.
CAT scans?
I did.
Did you receive the actual MRI film, the CAT scan film?
No.
You haven't viewed those yourself, have you?
Nope.
Do you agree with me that when they did the initial scan of his brain, that he had a 4 to 5 millimeter thick overlaying the right frontal lobe?
Yes.
Subdural
I have no
hematoma.
disagreement with the interpretations.
Do you agree that by the next day it had expanded to 7 millimeters thick with interval development of intraparenchymal I'm not sure what that last word is. Excuse me, let me look. It's difficult when you can't read your own writing.
I understand. I have the same problem.
Hemorrhage.
Yeah, no, I mean, you know, I don't have any disagreement with the interpretation.
So his subdural hematoma was getting worse, was it not?
Well, you know, yeah, a little bit.
Okay.
4 to 5 millimeters to 7 millimeters. You know, that's not a big deal.
Well, I mean, it's at least a 4 millimeters to 7. It's almost a 100% increase.
Well, you know, if you look at CT scans, it's hard to measure millimeters, but it appeared to them, whoever interpreted this, as it was somewhat worse. I have no disagreement.
Okay. And he was put in ICU, and he stayed in ICU to December 3rd.
Oh, absolutely. I would put him in the ICU too.
So this was a serious injury, was it not?
We have subdural. I don't think there's any question about it. However, remember that you know, what you have to do most of the time is watch subdurals. You know, if you operate on them, the morbidity and mortality becomes rather significant, and people can die from the operation in doing that. I think the neurosurgeon who saw him called it a mild head injury with a subdural. And if you want, I'll read that record to you.
No, he did, and then by the time they discharged him, they called it a moderate, didn't they?
Well, yeah, and that's okay.
Okay. And then by the time Dr. Volters saw him, he called it acute, did he not?
Well, it was acute. He had it
Okay.
right after he fell.
And there's no objective evidence or finding or medical record other than the VA records that he ever had this head injury prior to December 1st, 2010.
Well, at least according to the VA records, he had multiple head injuries.
I'm just telling you, other than that.
No, other than that.
Thank you. And by the time he went to the Memorial Hospital in Gulfport 2 days later, he had an additional small extra-axial hemorrhage involving the floor of the right anterior cranial fossa on the next
right.
hip.
That's right.
You don't have any, he didn't see any medical evidence that this subdural hematoma is gone, do you?
Well, they usually resolve themselves. I mean, he has no deficit, no neurological deficit. He has no paralysis. He has, wait a minute, listen. You know,
I'm listening.
and he has nothing different than he has reported since 2003. So I would assume that it's gone.
When you say resolved, that it's gone and disappeared and no longer in his brain?
Probably, yeah. That's what happens to blood. It resolves itself.
Yeah, but you didn't do a DME and do a CT scan and see if it had left, did you?
No, you know, in IMEs you don't do CT scans unless, you know, somebody orders that.
Would you clear Mr. Jackson to play contact sports like football and hockey and ice hockey and soccer?
Well, I certainly wouldn't suggest hockey or ice hockey. Whether he wants to play some tag football or things like that, yes, I have no problem with that. He didn't have any surgery. His brain is stable. Yeah, I don't see any reason why he could not do that.
But through the medical records, he continues to have problems all the way up until today, does he not?
the same problems he's had since 2003 and 2004, Mr. Clark. Read the veteran's records.
Yeah, and read his deposition about what he said happened at the VA.
Well, what are we supposed to believe when he goes to a doctor and tells him that he's had no headaches, and he tells the Veterans Hospital he's had headaches for 7 years, the worst he's ever had. He had to drink, take drugs to deal with all these issues. So what am I to believe?
That's what the VA says he said. Do you know the difference between service-connected and non-service-connected injuries with the VA?
Well, I assume, you know, it's whether you're in the service or not, but I don't know.
I don't want to assume.
I don't know the answer to that.
I didn't think so. How much did you charge as a retainer in this case?
I don't have a retainer. I charge $350 an hour to review records.
How much have you been paid so far?
I think somewhere around $1,500 to $2,000.
And can you supplement and tell me exactly what you've been paid? Can you fax us something so you will know?
Well, Mr. Johnson has a copy of the bill that he can certainly provide it to you.
Can you do that?
I think so. I'll try.
Okay. How much do you charge for this deposition and the preparation time for the deposition?
It's $350 an hour for preparation. It's $500 an hour for a deposition.
Have you ever testified for a plaintiff in a medical negligence case against a hospital doctor?
Oh, absolutely.
How many times?
10, 15 times.
Okay. About 98% of the time you testify for the hospital and defendant,
Well, prior to
provider.
6 or 7 years ago, that's the case. That's the only people that asked me. Subsequent to that, I have testified for a number of plaintiffs' lawyers.
Okay. That way they ensure that you don't testify for the defense, don't they?
No, I don't think so.
You don't think that's the case?
No.
Well, I know you had several wars with Ben Galloway, did you not? And,
Well,
now they'll hire you occasionally, don't they?
Well, I mean, you know, I think they're honest, good lawyers, and they accept my opinion as being objective. So that's why I've testified against them, I've testified for them.
You testified against them any more time you testified for them.
Well, not too many more times.
Who are those cases that you testified in plaintiff's case? I mean, as of about 8 or 9 years ago, you'd only done like 3.
No, I've testified a number of times for Mr. Goldberg in Chicago and all of his associates, a lawyer out of Tampa, I'll think of his name in a minute, Mr. Taylor here in town.
You've done it probably, what, 1,000 times?
No, not quite that many.
How many?
Probably about 600 depositions.
600 cases?
Yeah.
Or 600 depositions, because every time you give an opinion, you don't actually...
No, I've been reviewing cases since 1980, so,
Yeah.
over, 30 years.
You average what a year making off of those? About 100,000 or plus?
Yeah, somewhere around that.
Okay. And you keep all those records at home, not here at your office, right?
I do.
You have been disqualified from giving an opinion in a case?
I don't believe so.
And you've testified to that under oath before, haven't you not?
What's that?
That you've never been disqualified in a case, have you?
Yeah, to my knowledge, I don't.
Read something, see if this sounds familiar to you. You understand what penalty of perjury is, don't you?
I do.
It's a criminal offense, isn't it?
It is.
See if this sounds familiar to you. To put it as kindly as possible, the court finds that Dr. Chalhub's testimony was not only unreasonable, but indeed incredible for reasons too numerous to mention. One example will suffice. Dr. Chalhub testified that fetal heart tracings are meaningless and provide no information on the status of the fetus except to indicate in utero fetal demise. Why the fetal heartbeat, which is universally routinely monitored when of no value, Dr. Chalhub failed to explain, and he put a footnote on here. All of these witnesses testified that had Kevin been delivered by 7:30 to 8 a.m., he would have been normal. The court notes that one witness was a party defendant, 2 witnesses were hired by defendants, 2 witnesses were hired by plaintiffs, and 1 witness was plaintiff's treating physician at Miami Children's Hospital who owed no allegiance to either side. Dr. Chalhub stands alone.
Well, that's first of all.
Let me ask you a question.
Sure.
You listened to that. You remember that?
I do,
Let me
absolutely.
object to the form and relevance, etc. Go ahead.
And that was the Bravo case against the United States of America.
Right. I wasn't disqualified, okay? That was a statement made by the retired federal judge. First of all, it's inaccurate. I never used the word meaningless. Second of all, it was appealed. It was, first of all, the judge remanded his verdict, and then it was appealed to the 11th Circuit, and it was overturned. I also testified that child, wait a minute, let me finish, that child would not live more than 5 years. The child died in 2 years. The plaintiffs testified he would live 60 years, and they were obviously in error. Wait a minute, let me finish. You need to get all the facts correct.
Yeah, the appellate review had nothing to do with your opinions, though.
Oh, the appellate review had a number of things to do with the way the case was tried.
Yeah, but it didn't have nothing to do with your opinions.
Well, my opinions were obviously correct, because he didn't live 60 years.
What about Cullum versus Mackey? All excluding of expert opinions on Dr. Elias Chalhub. That's in Tennessee. This other case was in federal court in Florida. This is a state court in Tennessee. This is in May 2008. The Brazo case was November 2005. Do you recall that?
I do. Let me tell you what happened.
No, hold it.
Sure.
I didn't ask you to tell me what happened. You were disqualified.
No, I was not allowed to testify, not disqualified.
Your expert opinions were excluded.
As well as the other pediatric neurologists. But the case was tried, okay? They used the same opinions we set forth. It was a defense verdict. The case was appealed. It was tried again. It was another defense verdict. It was appealed. It was tried again. It was a plaintiff's verdict. It's going to be tried for the 4th time.
Why? Let me ask you a question. Why do you sit here and testify on the oath that your opinions have never been excluded when in fact they have?
You said disqualified. I did not. I was not disqualified. It just said that those opinions, according to that judge, said that he thought they may be speculative, not disqualified. Now, I certainly wasn't disqualified in the Bravo case. That went on to appeal.
Bear with me just a second. Well, then, you do admit at the very minimal that your opinions have been excluded in a number of cases, do you not?
You know, there have been 2 people in over 30 years that have disagreed with me, and I don't think that's too bad.
Well, in the Brazo case, every doctor other than you disagreed.
Why don't you get the transcript of that? That's not true. The defense expert certainly didn't say what was reflected there, but and I certainly never used the word meaningless. Why don't you get the transcript and read it? You know, that was the worst case of an infection that I have ever seen in my practice history.
I've read the findings of fact and conclusions all signed by the judge.
Well, why don't you get the transcript and read the case? And if you want to get it out, we can certainly discuss
well, that
it.
was a finding of the court, wasn't it?
No, the finding of the court is also an error. The fetal monitor has never predicted brain damage. That's in every single article. The judge refused to read the articles. Now, I can't do anything about that.
Is that the judge you called senile and 85 years old?
He was, no, I didn't call him senile. He was elderly and he was asleep. during the trial, at least part of my testimony.
No further questions?
Doctor, you were asked questions about records from other places. I'm going to show you again this note from October 3rd, 2011. How does Mr. Jackson say he has been handling his problems, through what means? He indicates.
No, let me object to the statement that Mr. Jackson says. That's what the VA says Mr. Jackson says.
Okay, that's what the VA says. What do the records reflect Mr. Jackson said he was doing to handle his problems, where it says he indicates?
Okay, the VA records of 9/30/2011 says that he indicates, I've tried to work the problem for 7 years, but I didn't do a very good job.
That's all I have. Thank you, Doctor.
Thank you, Doc.
You're welcome.
The time is 5:19 p.m. This is the end of tape one. This ends this deposition.